Good afternoon. My name is Christina Stachowicz, and I'm going to be doing an informational speech on childhood vaccines. There is my delivery outline. Vaccines. I know when I said that, everyone had either a negative or a positive thought almost immediately, and that's okay. With all the controversy, all the questions, all the what-ifs regarding vaccines, it's easy to question them. Hopefully today I'm going to give you a little bit more information as to what a vaccine is. Are they safe? Are they effective? Why are parents still choosing not to vaccinate their children? So let's start off with what is a vaccine. A vaccine is a weakened version of the disease that creates immunity in your body by creating antibodies that your body will then fight off to help fight that disease. Vaccines have been beneficial in decreasing several diseases and have gotten rid of other diseases. Some of the vaccines that are available today are polio, flu, measles, mumps, rubella, pertussis, tetanus, hepatitis B, and others. One of the main things that people think is, are vaccines really effective? The answer to that is yes. They are 90 to 100% effective. Let's look at some specific numbers. According to the CDC, since vaccines have become a vital part of our medical care, hepatitis has dropped by 70%, measles have dropped by 99%, pertussis by 84%, polio and chickenpox by 100%, and tetanus by 96%. Those numbers definitely show us that these vaccines are effective. Another question that most commonly comes up is, are they safe? The answer to that again is yes. The FDA does extensive research and extensive studies. Independent scientists around the world do studies on these vaccines to make sure they are safe before we give them to our children. Even though scientists consider vaccines to be among the greatest success in public health, there are still parents who choose not to vaccinate their children. Vaccines have many other benefits. They help save others. They help save time. They help save money. They help the future generations that are coming. They help the patients who cannot receive these vaccines for different various reasons. Just as all other decisions, vaccines have their advantages and their disadvantages. It is up to the parents to decide if the advantages outweigh the disadvantages. There's a lot of unreliable information out there that parents have access to. One of those is a British surgeon by the name of Andrew Wakefield. He is also known as the father of the anti-vaccine movement. In 1998, he published a study that stated that the MMR vaccine was linked to autism. Since then, that has been known as not to be true. There were scientists around the world who did their own independent studies to make sure this was not going to be a problem and make sure that this was not the truth. And it was not. Since this time, Dr. Wakefield has been restricted from practicing all medicine and has been revoked of his medical privileges. This is why doing in-depth research on reliable sources is so important. Now that we've looked at to why vaccines are important and why parents have so many questions, let's look at why parents still choose not to vaccinate their children. Some parents choose not to vaccinate their children because they have a fear that the child is going to get sick. They have a fear the child is going to get that disease that they're getting that vaccine for. Another fear is the fear of autism that we just spoke about. Some parents don't want their children to have all the injections. There's religious reasons. The big one is lack of education. Like we mentioned before, it is so important for everyone to do research on multiple reliable sources before making a decision not to vaccinate your children. I previously worked at a pediatrician's office, and we would get newborn parents in there all the time questioning vaccines, and it was our responsibility to give them the resources and give them the information they needed to be able to make an educated decision. As a parent myself, I understand not wanting to see your child hurt, but knowing the risk that I would be putting them at not giving them vaccines, it's worth it. As humans, we easily want to jump on a bandwagon. We have the want to be different. But with the concrete data showing how effective vaccines are, we need to make sure that all of our children are receiving these vaccines. In conclusion, most of you will still have a positive or negative thought on vaccines, but hopefully will be more informed. Dr. Paul Offit, who is an American pediatrician specializing in diseases, vaccines, and is the co-inventor of the rotavirus vaccine, said it perfectly. It is not about sides. It is about data and what the science teaches us. We all know the numbers don't lie.